Well, as the Trump administration pushes for that ban, the Los Angeles Times reports that the FDA tried to ban flavors years before the vaping outbreak. But the Obama administration officials rejected the plan. Some health and policy experts say that the flavored vaping and e-cigarette products have led to millions of children and young adults getting hooked. The CDC says that by 2018, about 4.9 million middle and high school students were using tobacco products. Emily Baumgaertner joins us now. She's a science and medicine reporter for the Los Angeles Times. So, Emily, the FDA wanted to ban these flavors as early as 2015. What studies and information did they have at that time to make that decision?
In 2014, it was already clear that the increase in youth vaping had gone up 800% in just 3 years. So the FDA was well aware of what the concerns were. They had lots of evidence to back up their concerns, and they went ahead and submitted a draft proposal for a ban to the White House.
So the FDA and the Office of Management and Budget held dozens of meetings on this issue. Who did those Obama administrations consult?
So whenever a rule arrives at the White House for approval, the economists there have an opportunity to meet with any member of the public who would like to voice their opinion. So there was a strong showing from tobacco companies, but there was also a strong showing from small business advocates. The Small Business Administration, which is a federal agency that advocates on behalf of small businesses such as vape shops, was present at, I think, almost every single meeting that the White House hosted on this issue. So I think a lot of people would like to think this is a story just about the tobacco industry's relationship to the administration, but there's also an honest argument on their behalf for what effect there would have been on small businesses.
So do you think it's the small business angle that ultimately made the administration decide against banning flavors? I'm curious what it was.
You know, we can't speculate on that. We don't know what happened within the White House. What we do know is that the FDA sent the rule to the White House, including a flavor ban, based on the recommendations of many public health officials. And when it came out of the White House and was published, that ban was gone. So the White House's argument, the White House from the Obama administration has argued that the science at the time just did not seem to outweigh the economic burden that this would have on small businesses. That's the argument that they're putting forth.
And the thing is, it's not even the economic burden people are concerned about. I mean, you spoke to tobacco and policy experts who said that decision not to ban these flavors would then ultimately now lead to what we have, this youth addiction. And he said that this was the moment we'd go back in time machine, that moment that we would have nipped this disaster in the bud had they had taken action. So is this how most health advocates feel now with the luxury of looking back?
That's exactly right. I think it's important to step back from the current vaping outbreak as we're hearing about. This pulmonary infection is terrible. Everyone agrees on that. But the larger issue is going to be in the long term. We're talking about 800 cases here. We're talking about 12 deaths so far. But in the long term, we have 1 in 4 high school students who are using these vaping products, many of whom will become addicted to nicotine. That's a problem because doctors project that many of them will switch to regular cigarettes in the long run. And regular cigarettes have horrible health effects.
Yeah. And, you know, the Trump administration is also now looking into passing a ban on flavors that could, what do you think could stand in the way of this getting passed?
You know, at a time like this, it's a tricky question because many people were hoping that e-cigarettes could be a smoking cessation tool, that if put into the right hands, it could help adults switch from their pack-a-day cigarettes over to e-cigarettes. The FDA at the time said that they found that the evidence for that was mostly anecdotal, that most people who used e-cigarettes in addition to cigarettes never actually switched over completely. But at a time like this, when you have teenagers who've never touched a cigarette using vaping products, the concern is that if you take the flavors off the market now, how many of them who are addicted to nicotine are now going to switch back to cigarettes?
Emily Baumgaertner, thank you so much for joining us from the LA Times.
Thank you.